it to start. First of all, before you bill, you need to make sure that your payer settings are set up correctly. So under list, under payers, you want to make sure that each of your payers has the appropriate information. The main things we're looking for there, number one, how do we check eligibility? Dorado is our integrated eligibility check. So you would put in Dorado and the Dorado payer code from the Dorado payer list if you want us to check eligibility for you when you click the eligibility button. We also need to know if this payer requires an OASIS or if they require the patient to be homebound. And then most of your billing information is handled under this claims tab. So you want to make sure you tell us which claim form we're going to bill the insurance company on, whether it's a UB04 but billed as a PPS model, a UB04, a 1500, a self-pay statement, or an actual larger invoice option. We're going to try to bill everything electronically unless you tell us not to. Just to run through these options briefly, use service-specific primary diagnosis code. In that case, we would use the diagnosis code assigned to the service category for the patient rather than just the patient's generic default diagnosis code. That's primarily utilized by therapy companies that offer multiple disciplines like physical therapy versus occupational therapy. That allows you to have 10 diagnosis codes for your patient, but to specifically allocate one for OT and a different one for PT. You would want to enter in the default type of bill, the default claim indicator, insurance type code, contract number, are specific to the individual insurance. You could put in the day that your contract renews with that insurance company so we can remind you that the contract is coming due. And every now and then insurance companies will have a limit on the number of charges or encounters you can include on a claim, so you can set that as well. And if we're billing electronic claims, you're going to tell us what submitter account you want us to use, the default header information for those claim files, the billing provider, who you want us to use as the billing provider on your claim. Answering the question earlier from this morning about the ABA or the behavioral health or therapy situations where you want to bill under using the therapist information rather than the actual agency's information. This is where that's controlled. By default, we're going to use the office information for a home health agency. We would assume you're going to bill underneath your office NPI number. But you do have the capability of saying that you want to use the billing agent information with their NPI number and address. So you have quite a few options available to you there, as well as for the taxonomy code and the other ID number. In situations where you're using the billing agent name, you may want to use the billing agent's other identification number from their agent lookup table. I won't deal with that today, but you've seen some of the options for that. But you have some very complex billing scenarios that you can handle directly through the software. Same thing with the rendering provider. Normally we don't use that because the billing provider and the rendering provider are the same, but you do have the option of setting that per payer if needed. So it can be the agent who actually performed the visit. It could be the case manager who supervises the agent or the patient, and which allows you, instead of having a PTA bill the claim, this could be assigned to the actual PT who supervises the case, or you could use the billing agent name and NPI number. So again, a lot of very advanced functionality that's a little beyond the scope of this training, but I wanted you to be aware of where those settings are handled. If you're billing a hard copy claim, you have very similar options available that you can set. And then on all claims, before you bill this insurance company, you can tell us what requirements are necessary, or we'll error that claim out. So if the insurance company requires the patient to have a primary physician or a taxonomy code, if it requires a referring provider, if you want to split overnight shifts, if you want to group charges individually, which is the default, or we can group them by date of service or by revenue code or by HCPCS code, how often you want us to bill the available charges, if you want us to wait until the end of the day or the end of the week, what the timely filing deadline is for this insurance company. So we'll tell you when you have charges that are coming up on the timely filing deadline. For cash flow management purposes, you can tell us how quickly this payer normally pays claims, whether they require a face-to-face document, if they require a Q code. So a lot of other really advanced options for claims. I just want you to be aware of how those are set. And then under services, you have the fee schedules for this particular payer. So if you set the fee schedule up on the service level, it will default for this payer, but you do have the capability of seeing that entire fee schedule at the payer level as well. So if you wanted to override the default, which is what this is telling you, this is the default fee schedule for all payers. So by default, this payer is going to utilize this fee schedule. However, we have set up a custom fee schedule for the adult RN visit. So if you wanted to override this fee schedule for Aetna here, you could just click this button and set up a particular fee schedule just for Aetna. Okay. All right, so that's setting up your payer.